I want to turn now to rheumatologist Dr. Geeta Nayyar. She's an assistant clinical professor of medicine at Florida International University. Dr. G, thanks so much for being with us. I know it is tough times all over the country and including in Florida, which has just surpassed 900,000 total cases. Now we're seeing the nation at 250,000 deaths. What is your reaction to hitting this milestone?
Brianna, thank you so much. Listen, this is a tough time in the year for all of us. We're all looking forward to the holidays. We're all missing our family. I miss my mom. It is incredibly important that we realize the tragedy that we are seeing is 100% preventable. It is up to each and every one of us to do our part to turn and flatten this curve.
Yeah, and that's the thing is we have the holidays upon us. And I know there are a lot of people who they're trying to figure out a way around this. They're trying to think of maybe a testing strategy so that they can get their kid home from college or so that they can go see their elderly parents who they haven't seen in a while, but they really want to see. What do you say to folks who are thinking about that?
Sure. So Brianna, the first thing I say and what I tell my patients is I understand. I understand that we're all tired. I miss my mom. I miss my dad. Please get creative. Stay in your bubble. Get creative. At our house, we're doing a virtual tandoori turkey. You're more than welcome to join us. But the important thing to actually remember this holiday season is the spirit of the holidays. It is to take care of one another, be thoughtful, send everyone you love a mask. And if you have a special situation that you feel you need to travel for, despite CDC guidelines, please talk to your doctor. Please talk to your doctor about what opportunities you have to mitigate your risk, but keep your family safe.
That's such good advice. I do want to talk to you about these potential, they seem to be vaccine breakthroughs. We're still awaiting, obviously, some key data, but Pfizer and Moderna are planning to apply for emergency use authorizations for their respective vaccines tomorrow. When the vaccines are ready and there are people who refuse to take it, then, you know, what happens? So how does society, how do workplaces, schools, how do they manage that?
Sure. So the important thing to remember is we have a path forward. This is positive news. There's a lot to be thankful for this Thanksgiving, but vaccinations only work if we take them. Just like we turned out the vote, we have got to turn out the facts. It is up to us, we the people, to get smart, improve our health literacy, understand why we have to wear a mask so that we wear it. Patients have questions all the time about stuff they hear on social media, stuff they hear from their political leaders. The only person you should be making healthcare decisions with today is your doctor. You don't have to trust me. Talk to your doctor. They will guide you correctly when and where is the time to take this vaccine and what you can do in the meantime.
President Trump right now is not allowing the transition to go forward as usual that would allow Joe Biden, the president-elect, and his team from getting information about vaccine distribution, about stockpiles. What concerns do you have about how that is going to affect the coming months for the country?
Every day that we delay this transition is more and more time lost to preventable deaths. It is unacceptable. We need to take a cue from the scientific community. The reason we are on the verge of these breakthroughs in medicines and vaccinations that are going to be available is because the scientific community has led with collaboration. The scientific community around the globe has put aside research, focused on COVID-19, and shared and collaborated like we never have before. And let me tell you, academia has its ego as well. But we understand. We understand this is not about one individual. This is about all of us. We are going to do this together, and all of our leaders need to let scientists and doctors lead, and we, the people, need to listen and get smart and improve our health literacy across the country. That's the only way we can do this. This is a team sport. We have got to do this together, and if you don't trust me, please call your doctor. They'll explain it to you way better than any political leader ever could.
Dr. G, thank you for joining us. We really appreciate it.
Thank you, Brianna. I hope to see you at Thanksgiving.
Thanks for the invite. So kind of you. I really appreciate it.